Hi, this is Dr. Robert Davis with My Sherman Dentist, and today I wanted to take a few minutes and explain to you a little bit about my philosophy of how dentistry is like a ladder. Now, I know a lot of you are thinking, what could a ladder and dentistry have in common? But I like to use this analogy with my patients because I describe the steps in dentistry, or what we often call the death spiral of a tooth, as steps on a ladder. So when you're standing on the floor, you're a perfectly healthy tooth, there's nothing wrong with it, and that is very stable as you can be. As you take each step up the ladder, you get a little more unstable. So the first rung of the ladder is just a little filling. Fillings last a long time. If they're small, no big deal. If that was to fail or the decay was bigger, you have a medium-sized filling. That's rung 2. Rung 3 would be a large filling. After large fillings, I don't typically do extra large fillings. We typically would go to a crown because we've lost enough tooth structure that a filling isn't going to hold in there any length of time at all. So rung 4 would be a crown. Beyond a crown would be maybe a root canal in a crown. So drilling a hole through the crown or having to replace the crown and getting a root canal. If a root canal fails, sometimes it can be retreated. That'd be another rung up the ladder, but we're getting pretty shaky at this point. If that fails or doesn't work with the retreat, then the only option left to treat the tooth would be to extract it and replace it with an implant. Now, implants are very stable. They do last a long time, but they don't last forever. Anyone that tells you implants can't fail or that they're going to for sure last your lifetime, I'd have some argument against that. So I think implants are a great replacement for a missing tooth, but I don't encourage anyone to skip rungs on the ladder and jump to implants just because they think that's the end all or that they'll never have to see a dentist again. Because the implant is the top rung of the ladder. You're balanced up there and leaning out, and it gets pretty precarious. So if you were to have an implant fail or fall off the top of the ladder, what I tell people is you hit the ground, and it's a long ways down from that. So we try not to skip rungs of the ladder here at My Sherman Dentist. I try and treat everyone as conservatively as possible and do the necessary dental treatment, but don't skip steps. Try and stay as close to the ground as possible. If we get to where we need implants, we do implants. I love implants, but sometimes a filling or a crown is a better option than pulling a tooth and going with an implant or a bridge or something along those lines. So we'd love to see you as a patient. We'd love to have you in and do an exam and x-rays. We do have a $49 coupon right now, so we can do exam, x-rays, and a treatment plan for just $49, and we can discuss what would work best for you in your particular situation. So again, Dr. Davis, My Sherman Dentist. We're right here at the corner of 75 and 82 in the same parking lot as Sam's and Tractor Supply. We'd love to see you. Have a good day.